So, when we talk a little bit more specifically about postpartum recovery and trying to kind of map it out, through those first 3 months and beyond, there really actually is limited literature looking at this topic, which is interesting. But I think one of the reasons why there isn't a lot of clarity in the literature in terms of really being clear about what healing is happening at one point is because healing and recovery is actually so context dependent. It really can dramatically differ from one person to another, depending on a whole bunch of factors. And we'll be hashing those out all throughout the two levels of this course. But we do have some data to give us a little bit of guidance. So certainly we understand sort of the first kind of 12 hours to really be this acute period, this rapid recalibration of sort of like hemodynamic systems. This is when there's like risk for hemorrhage, and we really need a lot of monitoring in this period. So this is when women will actually need to kind of stay in the hospital if that's where they've birthed to be monitored, or if they've had a home birth, they would have their midwife or other care provider stay with them until really they've been monitored and deemed to be cleared out of this first period, right? So this is our acute period. Then we move into our subacute period, which is sort of up to around that 6-week mark, right? So we have organized all our care around this 6-week postpartum check for the most part. Although certainly in Ontario, where I live, the model that midwives practice under is they actually do a check at 2 weeks also. So they'll do a check at 2 weeks, and then they'll do one at 6 weeks. They might also do one at 4 weeks. And so again, they're getting a little bit more care, but we kind of see this subacute stage kind of ending at that 6-week mark, which is why our care has been organized that way. So this is where we're doing less kind of rapid adjustment to all of the different systems, although all of that calibration is still happening. We have all those notable hormone players that we talked about in the last module, in module 2.1, that are kind of recalibrating and adjusting. So we need to kind of consider that. And we really are trying to get this achievement of homeostasis, and it's influenced by so many different things. We certainly have some data to show that by the 6 weeks, 6 to 8 weeks, that the uterus, for the most part, is back to its normal size. For the most part, women are no longer bleeding anymore. So there is a degree of kind of recalibration that has happened for the most part in these women. We also know that, standard soft tissue healing generally occurs, as long as it's occurring within a half decent environment, generally occurs within 4 to 6 weeks. So this is another reason why we can think, okay, if there was trauma or tears to the perineum, if there was a cesarean birth done and now there's a scar, we can have some degree of assurance that a good bit of that kind of acute healing has happened in those first 4 to 6 weeks. And then we move along to this kind of delayed period. So we kind of have the first part of this delayed period takes us up to the end of the 4th trimester. And then we tack on another 3 months onto that, right? So it's kind of up to the 6-month time. And again, the recovery is gradual over time. The restoration of the connective tissue is gradual over time. It's affected greatly by different factors that the woman is going through. So some women might find actually that they hit that 6 or 8 week mark, and then they all of a sudden find that things get a little bit harder because maybe their baby actually starts getting a little bit fussier in the evening. That typical behavior that has kind of been termed colic, that can sometimes pop up at that time. We also can sometimes have babies sort of changing their day, night, and their sleep cycles sort of just after that 6-week time. So they can really be in that newborn sleeping quite a bit to shifting out of that. And sometimes that can actually be a harder adjustment for mom. So we have these adjustments that we have to be mindful of. We also need to have on our radar the presence of issues like incontinence and pelvic organ prolapse. So pelvic organ prolapse usually we'll see happening, downstream, but sometimes it can pop up in this time. But certainly urinary incontinence that doesn't self-correct on its own, sort of through that first 6 weeks, we know from data and frankly from clinical experience that it's unlikely to correct without us intervening. So all of these other things need to be on our radar. And we really need to make sure that we're just considering in this kind of delayed phase self-care on part of the woman, making sure she has adequate support, keeping in mind kind of some of the screening around, her mood, those hormones, what might be happening with that, her energy, if there's any energy deficiency. And screening is certainly important. And so we will be talking more about that.